Okay, welcome everybody to the Carcinoid Cancer Foundation's Facebook Live series. My name is Rain Bennett. I'm a filmmaker and video producer. I've been working with CCF for almost 10 years now, creating video content to educate neuroendocrine tumor patients and caregivers in the overall community and spread the awareness of this disease. So we're really excited to bring this series, this Facebook Live series to you. And if you tuned in last week, we had Dr. Aman Chauhan on to talk specifically about what's going on currently with the coronavirus or COVID-19 as it pertains to NET patients. And that was so effective. We got such great feedback and such great attendance that we are currently going to be doing this on a weekly basis for the next month. And so first, we want to thank our presenting sponsor, Lexicon Pharmaceuticals, for making this happen and their support of the Facebook Live series, as well as their ongoing commitment to the overall neuroendocrine tumor community and family. And today, our special guest is Dr. Eric Liu. How are you, Dr. Liu?
Hi, Rain. How are you, buddy?
I'm doing well. So for the people who don't know you, which you're kind of a rock star in the NET community, I've worked with you for a long time. Give us a little bit of a background, a little bit of your bio of how you ended up in this world of neuroendocrine tumors.
Sure. Before I do that, I want you all to see I'm wearing this mask. Very important. I've just read on the internet, because everything's true on the internet, that you can get coronavirus through Zoom. So I'm going to wear this today.
That's good. That's good to know. I feel safe.
I'm kidding. But wearing a mask, social distancing, we'll talk about that in a second, is actually very important, is actually having an effect. So anyway, so hi everyone, my name's Eric Liu. I am a general surgeon out here in Denver, Colorado, and probably a lot of you know me, and I specialize in neuroendocrine tumors. And basically I got into this business after I had graduated from my surgery training in New York City. And I went to Nashville, Tennessee, and I started to do neuroendocrine there, and I was very blessed to get my career started because I trained in Sweden with one of the giants of the field in Uppsala, Sweden. So me, my wife, my 2-year-old, and my 4-month-old, we got on a plane and lived in Sweden, and it was actually pretty neat. The weather's not awesome there in the winter, just so you know. But we learned a lot about neuroendocrine. I came back, we started doing this thing called the gallium scan, which a lot of you have had probably now. We started doing that as soon as we got back, because that was a low-lying fruit that we need to do to help people with neuroendocrine. And about 5 years ago, I since moved to Denver, Colorado, and I am in a private practice clinic now. And essentially, all I do is neuroendocrine. And so we see people all the time. We try to help them as best we can and do what we can. So here we are.
Well, thank you very much for your time. I see that we already have great numbers of people joining us today. So if you are joining us, we love to ask where you are signing on from in the world and really see the reach that these Facebook Live programs have. That's one of the most exciting things for us about these, is that we're able to reach and impact such a wide amount of people in a short amount of time without a lot of cost. So these are really effective from what we've seen, and we appreciate that. So tell us hello, tell us where you're coming in from. We have a little bit of a disclaimer before we get started, and then we'll get to everyone's questions, or as many as we can. The opinions expressed by the guest presenters, Dr. Liu in this case, as well as the questions asked by the audience, that's you guys, have not been created or suggested by the sponsors of the Facebook Live, and CCF doesn't endorse or promote any of the views, opinions, or information in this presentation. So audience members should not rely on the opinions or information expressed by the guest presenter, and should seek guidance and direction from their own medical advisors regarding any choices they make about their health and treatments. So that's a lot of legal jargon, but what it really means is we're going to do our best to help you in general terms today, but by all means, you should seek out and talk to your primary doctor and your healthcare team to learn about your specific treatment and what you need. And hopefully the information we give you today will arm you with some information to get the best treatment possible. To that point, we can't answer super case specific questions. If you ask them and they're very specific to your case, I'm sure Dr. Liu will do his best to answer in general terms to help you. If you need further clarification, or if we need further clarification, we may ask you to. And you can always follow up if we didn't get to your question to the Carcinoid Cancer Foundation, either here on their Facebook page or at carcinoid.org. So we have a lot of people, well over 200 already. So that's exciting. So we've already broken records today. Dr. Lou, what did I say? You're a rock star.
Oh, records. I love it.
All right. So we're going to go ahead and jump into it. Terry asks, how are sigmoid nets? And real quick, Dr. Lou, I want to say that a lot of our listeners may be first timers in the disease. So I'm going to ask you a few times to maybe, spell out acronyms and what they might mean, maybe define some terms that you're very familiar with, but maybe a first timer wouldn't be,
Sure.
just as a blanket statement. How are sigmoid nets currently diagnosed and treated? And what is the best practice for follow-up protocol and prognosis for patients with sigmoid nets?
Well, that's a very specific question to start off with.
Yeah. I just put them in the order that they came in.
I got you. All right. So let me explain. So the sigmoid is a portion of the colon, kind of towards the end of your colon, near your rectum. And it is kind of an unusual place for neuroendocrine tumors to come about.
Mm-hmm.
So usually they're diagnosed by colonoscopy, and they take a little biopsy. I can't answer that question because it depends on specifically on the person, what's going on, and things like that. What I can tell you, and let me just say something that Rain had. Let me piggyback on what Rain said. The reason I can't answer your specific questions, and I'm telling you just frankly and honestly, is because I need to study your case. Okay. Mm-hmm. So, for example, if people ask me this all the time, well, can you just tell me what to do? Like, I cannot. Right. I've tried this before. It just doesn't work. So what I need to do is I need to sit, I need to study your case, I need to look at all the data we have and figure out what's going on. So that's why we can't give you more specific information. And anyone who's part of my my group, the Dr. Lou's Zebras on Facebook, knows that I can't do this because everything is so specific. And especially for those of you who have come here and have sat in this room before, in this office, and we sat together, you see there's a lot of talk and a lot of study. So I can't really give you a whole ton of information specifically until I've really studied your case. So I just want to tack that onto the disclaimer. So there's a real reason for it, so you understand. So sigmoid neuroendocrine tumors are actually relatively uncommon and rare. In fact, neuroendocrine tumors of the colon are actually relatively uncommon and rare. They mostly come from the rectum, which is the very, very bottom portion of your large intestine, or they come from the small intestine, which is the, right before it goes into the colon. We get some from the appendix, of course, and we get some from the right colon, but it's not that common for it to come from the large intestine. So if you have a real diagnosis of something like a sigmoid neuroendocrine tumor, what you have to do is what everyone does. You have to go through a full evaluation, a full workup. It's always, in my opinion, that you should always see a neuroendocrine specialist, because neuroendocrine is a very different disease. It's a very different beast. And I know I'm probably preaching to the choir, but for the new people, you understand that it's a completely different disease. And whatever it takes to talk to someone or see someone who is a real neuroendocrine specialist, it really makes a difference. And I hate to say it, there are people who consider themselves kind of neuroendocrine specialists who don't do this like 90% of their day. You want to find someone who does this like 90% of their day, so that they've seen these various combinations and permutations of neuroendocrine. Because you all have heard me say this before, neuroendocrine is a wide spectrum of diseases. It's like 100 different diseases. And so you want to find someone who's able to sniff out the 100 different types of diseases to help you, the individual. Does that make sense?
Yeah. That's
so when it comes to being worked up, and being evaluated and doing all your homework, right? You don't want to jump right into doing surgery right away, because you want to make sure you do all your homework first. Because what if you do surgery and it turns out you didn't need the operation, right? I'm not saying that's the situation, but let's say it is a situation. You don't want to have to go through the operation and then have, burned a bridge or something like that. So you always want to be fully evaluated. You want to get blood tests. You want to get tissue biopsy, usually from a colonoscopy if it's from your colon. You want to do a full workup with a CAT scan to make sure that you can take a look at your whole body and see if you have anything. You want to usually do this gallium dotatate scan or net spot scan. So it's a very, very precise and important scan we do before you have surgery. And if necessary, maybe MRIs or whatever, depending on what you see. But again, the most important thing is to see a neuroendocrine specialist who can do this full evaluation for you, so that we can know what you're dealing with up front before diving into things and not really knowing what's going on.
Thank you. So everyone in our audience, we're going to try to mainly stick to the topic of COVID-19 and coronavirus today and how it applies to you specifically as a net patient. If we have enough time, we'll try to get to generic questions about the disease, but this is kind of what we're talking about today. And I don't think we'll have any problem because we have lots of questions that have come in already.
The real question is, can anyone give me a haircut? That's what I really need, because I have not been able to get a haircut. And I'm not coming to your barber ring.
Let me tell you something, Dr. Lou. I have solved this riddle years ago. I give myself a haircut every 3 days, so it's not a problem for me, buddy.
Fair enough. Fair enough.
Okay, so Chuck asked, people are asking on a number of discussion boards about delaying sandostatin and lanreotide injections due to the coronavirus. Yeah. Have you any advice on this? Should patients defer their shots?
Yeah, that is like the crux. That's the big question that everyone is asking. Mm-hmm. Let me tell you how I feel about it. So there are a couple of things to think about. The first thing is, what is the shot doing for you? So if the shot is making you feel better, making you function better, making you more healthy and having more nutrition and not going to the bathroom all the time, or making you not flush all the time. In other words, if you're treating it for like symptomatic reasons, then you need to have your shot. Because if you stop, people will say this all the time. I missed my shot by a week and I was miserable, right? So that is a very different thing. And then there's some people who are completely asymptomatic, and we're using the shot kind of as a means of controlling the tumor growth. Mm-hmm. So you have to first ask yourself, and your doctor, as Reen had said, make sure you ask your doctor or your healthcare professional, what am I using the shot for? And so if you're using the shot for just tumor control, it would probably not be unreasonable. And again, make sure you talk to your doc about it, but it would probably not be unreasonable for you to miss a shot here and there, okay? And, if we're blessed and hopefully things are starting to get a little bit better, and remember, the number of deaths is going to lag behind. So we're still going to have a whole bunch of deaths from coronavirus and versus exposures. But if things are starting to get better, like we're seeing in Washington State and hopefully, Lord help us, in New York, then hopefully things will get a little bit better. And it may just be a matter of one injection. So if you're symptomatic, I don't think there's a whole lot of choice. I mean, I think you need the shot. So that's the most important decision you have to make. Then the question becomes, well, what are the other options I have? Mm-hmm. Okay. So if the option is, well, I need to get my shot, or I feel very uncomfortable not getting my shot, then how do we deal with that? So if you go to a big academic institution, it's like walking into a city, right? So you probably don't want to do that because you want to be socially distancing, having at least 6 feet away. It's anyone who goes to a big university knows it's like walking through a small city, right? So that may not be a great option. So then the next option is, well, is there any way I could possibly have my shot someplace else? So if you have the shot, say, in your private your oncologist or local oncologist clinic, it may not be so bad. I'll give you an example. So for those of you who've been to my office, it's a very much more peaceful kind of a place. You park your car, you come up in the elevator, now you get screened, you see one nurse, she gets the shot ready for you, you get your shot, you walk out the door. So the number of touch points and contacts we've limited very, very much. And the reason I feel a little bit strongly about keeping patients having their shots done with us specifically is because our nurses are very, very good at getting the shot, right? And so I feel it's important that technical aspect of getting the shot is good, okay? So for example, if you're, but then again, we also have 12 offices scattered throughout the state of Colorado, so you can go locally and things like that. So if that's an option, you may want to think about that. Maybe you can ask your local oncologist, is it possible to get my shot there? And can I reduce the number of touch points? Another example, could you say check in and then wait in your car before, it's getting warmer now, so it's not so bad. Can you wait in your car maybe while they're prepping the shot up, may take half an hour, 45 minutes for the shot to be prepped. They give you a call, you come upstairs, get your shot, and walk out the door, right? Mm-hmm. So those kinds of things. And right now, people are very, very amenable to these things. Everyone understands what's going on.
Totally.
The other option, too, which you could definitely call either Ipsen or Novartis, they're the two companies that make the shot, the somatostatin and the sandostatin, and call them and say, hey, is there any possibility I get my shot done at home? Both of the programs have what's called a kind of a mobile administration program, where they can actually send a nurse to your house or wherever you are, and they can actually give you the shot there. It takes a little bit of paperwork. It takes a little bit of setup. So that, and you want to talk to your physician about it, but that might be an option as well too. Because the problem is we just don't know how long this is going to last. And if it does last for, I mean, hopefully it doesn't last for 6 months, but let's say it lasts for 3 or 4 months, you may not want to miss like 3 or 4 shots, right? So that may be an issue. So maybe you want to spend time now investing up front and trying to figure out how to do this and seeing how it works for you. If it doesn't work for you, then then you have to explore other options. But if it does work, it's something to consider.
Great, thank you. Hopefully that helps. That was from Chuck.
Hold on, let me, Rain, let me finish. I'm sorry, I'm a little long-winded, but Chuck's question is so important that so many people have any questions. Let me embellish on that a little bit.
Please.
The other thing to consider too is, okay, so if you're doing your shot for tumor control and you're going to wait for a couple months or two, fine. That seems reasonable within a medical thinking. However, if you have symptoms, okay, and you're doing it for symptom control, there are other options. So a lot of the time, people know that I say this, there are lots of ways I like to treat symptoms. And one is going right at the tumor. So we will go do surgery and remove those tumors. We'll do embolizations. We'll try to kill those tumors or stun those tumors. But right now we can't do that, right? We do have other medications and other options that people should be considerate of. So for example, if you don't want to go in and get your shot, maybe you can take what's called the rescue octreotide. So rescue octreotide is the one that comes in, I call them baby shots, but rescue shots. A lot of people are familiar with it. It comes in a small syringe, right? You can kind of pull it up, or they come prepackaged, and you can give it to yourself every day, like 3 or 4 times a day. It is a nuisance. There's no question about that. But it definitely is an option, right? And so you may have to do it for a month or two while you're kind of bridging through this. But that may be an option. But there are other options too for symptom control. We have this new medication called Zermelo, telotrestat. It is a pill, okay? So a lot of people who have carcinoid syndrome, have kind of diarrhea, they don't feel well. This might be an option too. You might want to ask your doc, hey, can I try this pill? You don't have to come to the doctor's office at all. He prescribes it to you. They mail it to you. You subscribe to to a nursing program where they support you through the telephone. So there's no contact at all. So you want to start to think more broadly. What are all my options, and what are all the tools in my toolbox that I can use to help myself during this period? And truthfully, if it works well, maybe it's something you can continue even after the crisis ends.
Perfect. That was very, very valuable information. If that was helpful to you out there listening, give us a little thumbs up. I see them coming in already without me prompting them for it. I heard that Dr. Lou really likes the heart emojis. So if you hover over the like button on the bottom left corner, it will give you an option to love this. So if that was helpful.
People who know me well know I like Star Wars emojis. Here, okay, I'm going to stop for a second, Rain. I'm going to give you a tour of my office. Okay?
Oh my goodness.
So this is my office. So a lot of you have been here before. It's like the zebra, spawn here. We have it everywhere around. And if you look, okay, this is my mother. So she can see all.
Yeah, now he's just showing off.
Yes, that she knows that. I mean, look. So there's lots and lots of zebra stuff around here. So if it's not zebra, then it's going to be Star Wars. My little friend. Oh, he fell down. Start fitting here.
Yeah.
Okay, enough.
All right. And I saw there was some happy birthday signs in the background. Was that for you?
Yeah, it was my birthday a couple weeks ago. Yeah.
Well, happy belated.
Yeah. Where's my gift ring?
It's in the mail.
I know it is. It better not be a pair of hair clippers.
The good thing is it's hair clippers and a beard trimmer in one. So someone like you, it's perfect. I can only grow a
Fu-Man shoe. I can't grow a beard.
All right. So Charlene asks, I previously had my spleen removed. If I get COVID-19, considering that, will I be able to fight it off effectively? Will that have any effect on her ability to fight it off?
That's interesting. I don't exactly know the answer to that question. I will tell you what I think.
Okay.
And the reason I can't tell you for sure is because we don't have hard information on it. Usually when people have had their spleens out, they tend to have issues with their blood and stuff like that, which you have to talk to your hematologist or your surgeon about. But in general, Adults who have their spleen out actually have an intact immune system. So they have a mature immune system. They've seen a lot of stuff in the past. And so, and they usually have been immunized. So for example, when I do a splenectomy in someone, I will give them shots so they're immunized against bacteria. They're a very specific kind of bacteria. So in general, your body has already recovered. I mean, unless you had a splenectomy last week, I guess it's a different story. But if you had it a year or two ago, your immune system's probably adapted enough that you're probably not any more susceptible to COVID than everybody else. It doesn't mean that you're immune to it. I mean, you need to do all the things. You have to wash your hands a million times. You have to wear a mask. You have to stay away. You have to do all the social distancing. But it probably doesn't increase your risk. And the reason I say that is because there are a lot of people who have their spleens and they're suffering from COVID. So it seems not to be an issue. But I'm not, I can't tell you for sure. But I don't think it's something you should be particularly worried about.
Okay, got it. Okay, so Karen asked about the lanreotide injections. Her doctor canceled. So hopefully, Karen, you were able to see the previous answer about different options. And that goes for anybody listening. If you've signed on late, this video will live on the Carcinoid Cancer Foundation page. So you're always able to come back to that and refer to maybe things you've missed or things you wanted to hear again if you wanted to take down specific notes. Okay, Helen asks, what progress is being made for an oral octreotide alternative?
Ah, wow, that's a advanced question. So, there are some really interesting things. So it's kind of everyone's fantasy to get an oral version of a somatostatin analog, is what we call it, because the shots can be not so fun.
Right.
But let me just say, just historically, the shots have really saved probably millions and millions of lives over the past 30 years. So it's been a wonderful treatment and tool to have for patients. But this kind of thing has been promised for a long time, and we haven't really made much progress. But there are now actually two versions, which may be coming out in the next, I don't know, let's say 5 or 10 years. I don't really know. We'll see how it goes. But there's one which is really neat. They have the octreotide molecule. In octreotide, is like a little protein. It's like a tiny little protein. And they've done some fancy way of encapsulating it so you can swallow it and you absorb it through your intestines. So that's one way. And then there's another way. Another company has developed a small molecule, which is actually not a protein at all. But what it does, it happens to be like a small medicine that binds to the receptor and does the same type of thing. What I can tell you is that it's not being used in neuroendocrine yet. Hopefully that's just the next step. It's being used in a disease called acromegaly, which is another kind of endocrine disease, but very much like the octreotide that was developed 30 years ago, amazingly 30 years ago. They're testing it in this field first. So hopefully, as soon as they get some success and we can learn about the medication and make sure if it works or doesn't work, or if it has any weird side effects, we can learn these things, and that may be something to look forward to. So it's coming along.
Great. Thank you. We have a couple different questions that are both about lung nets and dip neck. One, for patients, any specific advice for patients with lung nets or dip neck who already have a reduced lung function? How can they best protect themselves? And then the second question is, are they at higher risk of developing complications if diagnosed?
Yeah, that's an interesting question. Again, I don't know the answer, right? Because everything's so weird, but I can just tell you what I think. So people who have problems with lung neuroendocrine, be it dip neck or whatever kind of neuroendocrine they have, they usually have very much associated respiratory problems. So again, I'm going to sound like a broken record, so I apologize. But you got to talk to your doc about it, right? Because your thing is so specific. So if people are a little bit more dependent on oxygen, okay. So the first thing is do even be more diligent about doing your social distancing, because that's such an important thing. If you're already on oxygen, you have to be very sensitive, because what if your oxygen your oxygen needs change? Could that be the sign of something going on? I mean, I don't know. It's hard to say. You should definitely stay on all your medications and make sure that you're still well treated and breathing as best as you possibly can. Because one of the things we found in with COVID is that one of the first things that happens is people start to feel a little short of breath, and they have some fever, and they have, and some people are asymptomatic, but when it starts to kind of come around, that's how they feel, which may be very subtle in a person with neuroendocrine, right? Because they already have these problems. So you might want to be a little bit more sensitive, but the fever will probably be the thing that triggers you off, right? If you have a little fever. But if your oxygen requirements change, those things you have to watch out for. So I would say just be very diligent about it. And if you do get sick, hopefully you would have to, talk to the physician taking care of you and let them know that you have this, because it will make your x-ray more complicated to interpret, right? So an x-ray is not going to be meaningful. You would have to have a CT scan for sure. Those kind of small things that need to be figured out. And then the other thing too, is you may not want to jump the gun and say, oh my gosh, my O2 sat went down by 2 points. I must have COVID.
Right.
Don't be paranoid either, right? So it's a little bit of both. So you have to be sensitive without going crazy.
Copy that. What do you think about, is it okay for hospital workers to come home and share a space with net patients? What's the increased risk for healthcare workers?
No, that's an interesting question. So there is definitely an increased risk for health workers. There's no question. I mean, like the precautions I'm taking, I was kidding a little bit about the mask, but I do have to wear the mask everywhere I go in the hospital, right? And even now outside in the state of Colorado. But in the hospital, we do take very specific precautions. And so there was a COVID patient in our hospital. We don't have that many, luckily, but we have a couple. And we have to wear the special masks, and we have to be away from the patient in a certain way. And so there are a lot of important precautions that we're taking. So I guess part of it depends on how exposed you are and how much contact you have. So for example, if you work in the coffee shop, maybe,
Right.
you don't have to be so diligent about it. But if you're a nurse who saw a COVID patient today, I think it would be very reasonable for you to, of course, they should do this anyway. You should wash your hands multiple times a day, right? You should make sure you have the right protective equipment. Hopefully your hospital has enough. So if you have to change your mask, if it gets dirty. And then when you get home, and then you should probably wear scrubs, right? So you should not wear nice clothes. And then when you get home, if you have a neuroendocrine patient, you should wash your hands. You should take your clothes off. You should put it in the laundry, and you should take a shower, and then that's your routine for the evening. Again, just because a patient has neuroendocrine doesn't necessarily make them immunosuppressed or any more susceptible to it than anybody else. But again, it depends from person to person. We have medications, we have nutritional status, we have many things in our neuroendocrine world that can make people weaker. And if you're weaker and you happen to get coronavirus, it could be obviously worse. And so those are the things we have to watch out for.
Got it. So next we have a question from Susan, which is a good kind of general question, which all of us net patients are trying to or wanting the answer to. As the situation gets better, how do we know when it's all right to resume previous activities? We all have these stay-at-home orders, et cetera, and just supposed to do essential things or get essential items. Should net patients wait longer than most when we start to see the world coming back to normal?
My instinct would just be to be slightly more precautious. To be slightly more cautious. Let me explain why. And it's not necessarily specific to neuroendocrine, but the question will be, does the disease really linger, and could we get another peak? Mm-hmm. Okay. I am extremely curious to see what happens in China right now, because they just lifted Wuhan just lifted all their restrictions. And that's like 9 million people. And apparently half of them were in the airport yesterday. So we will see what happens. I'm very curious to find out. But for us, it's actually a little bit more confusing because we are getting a lot of very conflicting information from our government, right? So the federal government is saying different things from the state government, which is saying different things from local government. So I don't know. And the thing I worry about is, everything looks good. Things have flattened out, and all of a sudden it comes back, right? Yeah. So because this happens with flu as well. It happens with other kinds of viruses. So my feeling is to be cautious. Okay, if you don't want to wear a mask outside, okay, you probably don't have to do that. But I don't think there is any reason to go to, I don't know, let's say they opened up sports arenas again. Maybe you don't want to go to a 20,000 sport arena where you are jam-packed with people in the next 6 months. Maybe give it a little bit more time, be a little more thoughtful. It may be easier for you to get your shots, right? It may be easier to get your therapy. It may be easier to get your scan. So those things you might feel a little bit more comfortable about. But I think it's still very important for all of us, not just our neuroendocrine patients, but to be cautious about what's going to happen even when things lighten up. So you may feel a little bit better, but I definitely would not, I would not take it for granted, because we don't know if this is all going to go away. And we may hear things from our authorities which may or may not be true. And if just because a politician says it doesn't necessarily mean it's true. I think we all know that. So I think you have to be cautious, just very, very cautious.
Yeah, well, and everybody has an opinion now about what this is, what causes it, how long it's going to last, et cetera, et cetera. So we're hearing different opinions all over the place.
Right. I know, but the problem is you only have one life, right?
Right.
I mean, you know, they can say things to millions of people, but when it comes to what do you as an individual do, all you can do is be cautious and be thoughtful about it. That's all. I mean, that's how I feel about it. And so I think it's reasonable to do that.
Eva asked, even if those stay-in-place orders are lifted, is it true, this is piggybacking on the previous question, is it true that immunocompromised persons will not be safe until a vaccine is developed?
I don't know. I mean, apparently non-immunocompromised people are not safe from it. Yeah, so fair. I don't really know the answer. I mean, I hate to say this. I mean, I do know some people who have COVID who I thought, and I don't know, but they seemed perfectly healthy when I would talk to them. And now they're on ventilators. I mean, it's real. I mean, this is real. And so, you know, we've had some terrible situations that I've heard of around the country, and just all the stuff that you're hearing is true. So what was the question, Ray? Say the question one more time.
Will immunocompromised people basically have to wait until there's a vaccine developed?
Oh, the answer is yes and no, because just if you're immunocompromised, you should always be a little bit more cautious, because what if you get the influenza virus, right? I mean, there's truth to that. Still, there are more people that die of influenza virus than die of coronavirus so far, right? So all these things are extremely important, and you have to just be more cautious when you're immunocompromised. And again, there are different degrees of immunocompromise, but the one thing that we have to deal with in neuroendocrine are people who are on chemo, like real chemo, and people who take these medications like everolimus, because everolimus is a well-documented immunosuppressive medication. Sure, we use it for cancer, but they use it for transplant specifically to immunosuppress you. So, for example, if you're on that kind of thing, and again, you want to talk to your physician about it, you always want to be just a little bit more cautious, because there's always something that can happen. It's not that we can't help you and treat you and things like that. And if you got influenza virus or coronavirus, I'm sure we could, we'd help take care of you. But there's no question, the best way to take care of yourself is prevention. The treatment afterwards is always worse.
That's a great little takeaway right there. Let's see. What about, Jack asked, what are your thoughts on going in for scans? We talked about the shots a little bit, but what about going in for scans at this point?
Yeah, no, Jack's question is very important. Again, depends on how you want to do it. There are certain scans. So there are certain patients who are actually in pretty good shape, and maybe you need a scan once a year, or maybe you need it, every, not so frequently. For neuroendocrine, unfortunately, a lot of our general practitioners who aren't so familiar with the disease probably overscan a little bit. They do too many scans.
Okay.
And so there may be a little bit of flexibility inside there. So what I would say is, if you don't need a scan now, ask your physician if it's okay to kind of delay it maybe a couple of months. I think it's probably okay in most patients. If you need it, then you have to get it. I mean, it is what it is. You have to go get it. But then again, like we said about the shot, are there other places you can get it? So if you don't have to go to the miniature city, like at the university, can you get it more locally? Are there other places you can get a CAT scan? Can you get it at a smaller hospital, which is maybe not overwhelmed with COVID, and so maybe you can have fewer touch points and everything's a little bit smoother and easier? So if you can do it that way, then it still may be important, because you can still get the information. You can walk out with the disc, you can take it to the doc, or they can transmit it to the doctor, you can take the report, whatever needs to be done. Because, for example, for me, if you don't have to physically be here, if you can get your scan done at home, you can mail it to me. It's great. There are caveats to that. Okay, so for example, if there's, for example, like our machine is very specifically tuned for neuroendocrine, so maybe the quality of the scan may not be quite the same. So there's a little bit of trade-off. So be wary of that. But again, if you need your shot, if you need your scan, by all means, get it. And if you can put it off, by all means, put it off. But if you have to have it and you want to reduce your risk, maybe you can find another place to do it. But Jack is right. It's a good question, and we should definitely discuss it with your physician.
Great, great. So I see we still have great numbers. I want to thank everybody for attending today's Facebook Live session with Dr. Liu. If you've just joined or you haven't been here the whole time, let us know where you're signing on from in the world. Let us know if we're giving you some great value, and get your questions in now. And a reminder, we'll be doing this with a different doctor for the next 4 weeks specifically about COVID-19 and how it applies to NET patients. So thank you all for joining us. And if you know someone out there, patients, caregivers, families, friends that would also benefit from this right now, go ahead and share the link, share it on your Facebook page, and let's get as many people here as we can. So next up, this is semi-specific, but I think we can handle it. Jane asked, my mom has been having heart valve issues due to carcinoid syndrome, but she's having a difficult time getting an appointment with a cardiologist because of COVID-19. What do you think her next step should be?
Oh, that's hard.
Too tough.
That's hard. This is what I would do. I would be extremely persistent and just keep calling. The other option is to ask your oncologist, your physician, if they can give you multiple recommendations from multiple cardiologists, and just start calling around as much as possible. The problem with people who have heart problems is that can be a rapidly deteriorating and lethal complication. I mean, like, oh, that's a real problem.
Yeah.
I would maybe reach out to some of the neuroendocrine experts around the country. You may have to travel a little bit to get the care done. As much as possible, work with the oncologist and find out if there are medicines that can kind of keep things temporized. But when someone has a documented carcinoid heart disease, that's a bad sign. And the faster you can fix it, the faster you can recover from it, and the faster you can prevent more damage. The problem with, so for those of you who don't know, let me just back up and explain. Carcinoid heart disease is a relatively unusual complication of metastatic neuroendocrine tumors, mostly specific to the small bowel. So what happens is you get these little tumors, and I'll just give you a typical example. You get these little tumors, they spread to your liver, which is the most common place that these new tumors go. And then they secrete a ton of hormone. We say it's serotonin, but it's probably more complicated than that. And then the very next thing that the hormone sees is your heart. It goes right from your liver right to your heart. And so all that hormone goes to the valve, and what it does is it burns the valve out. It scars it down. So normally a valve allows your blood to flow in one direction, right? So it flows down, flows in one direction, right? Now what happens with carcinoid heart disease is all of a sudden this valve gets scarred down and nothing happens. And now your blood flows forward and backwards. And when your blood flows backwards, you don't need to be a doctor. That's not good, right? So blood that flows backwards is bad. It hurts your liver, it hurts your kidneys, it hurts your body, it hurts you swell, it hurts a lot of things. So that's something that's important. So I would ask her, what was her name again?
Yeah. Her name was,
it's okay. Sorry, honey, I can't remember her name.
That was Jane's mom.
Jane, yeah. So Jane, so I would be particularly persistent about it. If you ask your oncologist and he says, well, it's very mild, don't worry about it, that may be okay. But if it's looking what we call moderate or severe, I would definitely be persistent about that and see if you can find someone who can help you soon.
Thank you. Hope that helps, Jane, and good luck to you and your mom. Denise asks, are there any other options for patients with a lot of liver tumors and seeding? And let's explain what seeding is, if PRRT and surgery are no longer an option.
Wow. That's a difficult question. So seeding is I don't really know what seeding means specifically to her case, so
Okay.
I can't tell you for sure. But in general, seeding means when you have lots of teeny tiny little tumors kind of all around. So it can be in your belly. So we have a fancy name called carcinomatosis. It can be seeded inside your liver, which we call miliary, or it can be seeded in the rest of your body, like your bones and your lungs and stuff like that. So it kind of depends on the situation. So if in general, if PRRT is not an example, so let me explain what PRRT is. So PRRT is a new therapy that's come out in the past couple of years. And basically what it is, it's an internal liquid radiation therapy. What we do is we take the little hormone that you guys are taking in your shot that we talked about previously, and instead of just making it a naked shot, what you do is you put a little nuclear bomb on the back of it. And then the shot is like a guided missile. So the guided missile carries the nuclear bomb inside, goes into your tumors, and you get radiation from the inside out instead of the outside in, which is much more effective for us. But there are multiple reasons why people can't get that particular kind of therapy. It's actually a great therapy. It's just that some people aren't qualified or they can't get it or whatever reason. So if you can't get the treatment and you have all the seeding, then you have to look at other things. First of all, most people start with a shot, like a somatostatin analog, either the somatoline or the samstatin LAR. And if that doesn't work, then you have to look at other things. And that may be like pills. So we have some medications called everolimus, or another medication called sunitinib. There might be some chemotherapy agents like temozolomide. Sometimes good old-fashioned hard chemo, through your vein is what you need. But if it's just, for example, in your liver, okay, so if surgery is not an option, and by the way, surgery can sometimes be an option and the oncologist doesn't realize that. So you really should consult with a neuroendocrine specialist who does a lot of surgery. It happens every single day here in this office. They're told they cannot have surgery when in fact you can have surgery and it helps a lot.
Wow.
Anyway, but if you cannot have surgery and you have all the seeding, then one thing to consider is if it's just in your liver, you might be able to have something called an embolization. Embolization is when they put a tiny catheter through your groin and park it in your liver, and then they can shoot, medicines and things like that can help as well. Again, something to discuss with your physician, something to look into. And if I may make another point for RAIN too. So definitely, if you can go to carcinoid.org, there's a lot of great information there. There are a lot of other resources as well too. So I know Facebook has things. We have our Dr. Lou Zebra Facebook. We also have the NANETS Society, the Net Research Foundation, and even my own foundation, the Healing Net Foundation. All of our websites have various types of information, so they may be helpful. There's another organization called the Neuroendocrine Cancer Awareness Network, which is a little bit more geared for patients. So all these kinds of things are good resources. You should just tap into all of them and see if they can help you.
Good advice. So a lot of the people are patients who are asking, well, we got a good question from a caregiver. So Gerald asks, what steps should a live-in caregiver take to protect a net patient from COVID-19? Or anything other than the normal advice?
Well, Gerald, the fact that you're on here is actually a great step. So what you're doing is important. So the first thing you can do, I know this sounds ridiculous, but you just gather information, educate yourself. And again, I know I'm preaching to the choir. If you weren't here, you wouldn't be wanting to educate yourself. So educate yourself, understand what's going on, understand what the treatments are, understanding what your loved one is at risk for. Understanding all those things is important. Okay, so now once you kind of have that information, then there isn't really that much that's different. You should definitely, go to the doctor's appointments if you need to. If not, if you can put them off and reschedule, by all means, do those kinds of things. Social isolation is very, very good, because if you don't have coronavirus and your loved one doesn't have coronavirus too, that's the best way to still protect yourself, just to keep distance away, right? And that's good for influenza virus, it's good for adenovirus, it's good for everything, right? So it's all everything. So that social distancing is important. So if you follow those rules and educate yourself, I think that's the best that you can do. Beyond that, it's just fate. If something, if something happens, it happens.
Yeah. Sherry asks, is there anything adrenal compromised net patients can do other than the precautions already in place?
Well, that's interesting, Sherry. So the important thing is stay on your medication, right? So people who are adrenally insufficient, so there are two little glands right above your kidneys. They're called the adrenal glands, and they make, adrenaline and stuff like that, kind of but way more important things than that. They're very complicated. They're very complicated little glands. And if you have no adrenal glands, which is not uncommon for our neuroendocrine patients because they have multiple issues or complications, then you need the medication to kind of stay on board. So I'm sorry, to keep your body running. So you want to consult with your endocrinologist, right? That's super important. Stay on your medication as you are, okay? Because remember, if you're taking adrenal supplementation, you're not actually, in theory, immunosuppressed, because you're just replacing what your adrenal glands would have normally replaced. You're not taking extra steroid to kind of suppress your body. But then do all the things like we mentioned, wash your hands, social distancing, and then stay in contact with your doctor and stay on your medication. I think those are the things I can offer for an adrenally insufficient patient.
Got it. I'm seeing a lot of questions about, that we have touched on already about octreotide, lanreotide, and scan. So I would urge everybody, if you've just kind of signed on recently, go back and watch the video. It's going to live right here on the Carcinoid Cancer Foundation page. It also is redistributed on the YouTube channel for Carcinoid. If you or someone you think that this would be helpful for isn't on Facebook, and we'll try to get to as many questions as we can, but we're seeing a lot of the same questions, which is good, because hopefully we're getting you the answers that you need. Let's see. Have you heard anyone? Hillary asked, have you heard of anyone specifically having carcinoid and also ending up getting coronavirus? And if so, what was the outcome? I'm not sure if she means carcinoid syndrome or a carcinoid tumor.
I have not heard. I don't know. Okay. Thankfully.
Yeah. Okay. We talked a little bit about home injections. So Karen asks, I'm trying to arrange a home injection of sandostatin. Do you have any tips for when the nurse arrives to avoid possible contamination?
Oh, that's interesting, Karen. In theory, she should know that.
Yeah,
she should have some training as a medical professional, because the nurse that comes in, he or she is a nurse, right? So they're a medical professional.
And they'll help Karen with what Karen should do on her end as well, is what you're saying.
Correct, right. Yeah. So the first thing may be just to call them when you're setting it up, just to talk to them and make sure, hey, what can we do? So just communication. There's a lot of low-lying fruit. I know everything sounds complicated, but there's a lot of simple things that we should all do. That's communication and practicing the social distancing. Okay, anyway, to get back to this, I don't really know. I mean, it depends on the situation. But I would say the easiest thing to do is to make things quick and easy for that nurse to get in and out of your home as fast as possible. So if you're going to have the injection, have it done, somewhere, near your door. And if you live in a tiny apartment, it probably doesn't matter. But if you live in a huge mansion, maybe you should, have it near your foyer or something like that. So those kinds of things. Make sure you're ready to receive them. Make sure if there's any pre-treatment, sometimes people put a little bit of numbing medicine on their backside before they get a shot. Try to do that in anticipation. I don't have anything specific. She should bring gloves. Mm-hmm. She's supposed to kind of protect herself. She should probably bring a mask as well. If you want to bring, have some masks on while she's there, I think that's very reasonable. But I think just the basic principles, I think, are important. If you can do that, I think you've gone a long way. But I don't think there's anything special or different you have to do.
Mm-hmm. Well, this next question is apropos of the mask topic, and Jennifer, Dr. Liu mentioned this as soon as we hopped on the call today. Jennifer asked, "What are your thoughts on the mask debate? Does wearing a mask offer any real protection?" And let's talk about how it does and what it does.
Yeah. So here's the deal, Jennifer. The answer is yes, but it's a much more complicated, nuanced answer. So, for example, when I'm in the hospital, that's a big deal, right? So I need to wear a mask as much as possible. This mask itself, okay. So I actually wear this type of a mask when I do surgery. And that's not really to protect, it's hard to say, but it helps to protect you against certain things. Apparently, this thing is not super awesome at protecting you against coronavirus specifically. However, it does a couple things. If you sneeze or something happens, it does catch the large proportion of it. And so it does have some ability there. So when you wear a mask, you are protecting yourself and you're protecting others, right? So I think it is the right thing to do. There is another reason that I wear a mask and feel strongly that it's important. And I'm not perfect about it, but I really try my best to do it. Like when we go outside, so I don't wear this at home. We just wear kind of cloth masks at home when we're going out for a walk, and we don't go out that much. But you want to protect yourself for those reasons. So you protect yourself and protect others, but also it's also a signal to other people that you are respectful of the fact that something's going on. And if you wear a mask, you're demonstrating to others that, hey, look, I care about you. I'm part of this too. We're all in this together. I'm not, I don't want to be judgmental, but it's a little irritating when when you drive past the park and you see people kind of hanging around, no one's wearing a mask and they're all together. I mean, it's just, that's not the point of this.
Yeah.
Our point is to protect all of us together. And this is the way we do it now. Maybe like in a year or so, what will happen is we'll have more what's called herd immunity. What that means is more people, unfortunately probably have the disease, maybe they develop some immunity. And so we as a people have more resistance against the disease, which is why immunizations are so important for children, right? There's a lot of controversy, but it's still an important medical thing. So when you develop this herd immunity, maybe you can protect yourself. But for now, since we don't have herd immunity, this is the way that we can practice that kind of herd immunity. And so, or herd protection, let's put it that way, herd protection. We know for sure that when kids don't get their measles shots, they get measles, and it happens. So that's something we have to just think about, what we've learned from other viruses too. So I like it. I think it's good for you, it's good for others, and it's a good social sign.
And it does actually offer protection.
It does offer protection. Yeah, it's not perfect, but it does offer protection.
Yeah. So everyone listening, we have about 10 minutes left with Dr. Liu. So if you have questions, let's get them in now. And if we can't get to them, again, I urge you to follow up with the Carcinoid Cancer Foundation, either here or at their website, carcinoid.org, and they will direct you where you need to be and hopefully find you a specialist that can help you further. Dr. Liu, Meredith asks, if I were to be hospitalized for COVID-19 and I needed a respirator and the hospital didn't have one available, I worry that the doctors might not give me one because they see stage 4 cancer on my chart. Wow. Are there certain things we should tell the staff if hospitalized?
Wow, Meredith, that is a complicated, difficult scenario.
Heavy question.
Oh, wow, that is a heavy question. Well, if you live in New York, that's a real possibility. It's a real possibility. Hopefully, if you live in Maryland or Colorado, it's not so bad. But if that happens, I think you have to do everything you can to explain to them that you have extremely low risk disease and you're otherwise healthy. Just keep telling them how healthy you are, and that the stage 4 cancer. Yes, I mean, it's true. You can't deny the fact you have stage 4 cancer.
Right.
But you tell them, I'm healthy. I'm under treatment. It's a very slow growing disease. And if you just keep stressing that, then they'll understand. And of course, if there's any issue, have them call your physician. Have the ER. I know it's not easy, but have the ER doc or whoever call your oncologist or your NET specialist and have them talk to them. I mean, thankfully, I haven't had the situation, but have them call me. I'll tell them.
Yeah, no, that's a good point. Yeah. We talked a little bit earlier about PRRT, which I think is always helpful. And Lisa asked, if you've already started PRRT, how long can you delay the rest of the treatments?
Well, that's an interesting question. So here's the deal, Lisa. If you're traveling for your treatment, okay, you should definitely talk to your physician and see if there's some way that you can maybe delay it. Okay. How do I say this? The protocol is pretty regimented, but there's actually more flexibility in it than most people think. Again, so if you're working with a neuroendocrine specialist, he or she will probably understand the nuances of the therapy a little bit better and know when it's okay. So to kind of get to Lisa's question, which is basically, if you have PRRT, the way we do it is you get 4 treatments in general, okay? Right. And they're spaced by about 2 months, so 8 weeks. And what can happen is your counts can go down, so you can be a little immunosuppressed. It is true. It goes down and comes up, you get your treatment, goes down. It kind of works like that. Does that make sense?
Yeah.
So Lisa's question is, well, okay, if I can't get my treatments, I need to spread it out a little bit. Is that okay?
Yeah.
The answer is it's probably okay. You need to talk to your physician. If you can get a couple of treatments in, if it's relatively low risk and your exposure is low, it's fine. If you have to get on an airplane to do it, then you may want to think about,
Right.
if you can reschedule.
Yeah. But hopefully, since they're spaced out that far, it wouldn't affect it, too much. Or maybe you can just push it back a little bit, and hopefully everything can get back to normal.
Right.
Yeah.
Yeah, and there's definitely truth to it. So there's no question that around the country there are different. I mean, this is obvious. There are different rates of COVID and how it's affecting the different
Sure.
places. New York City is getting hammered, right? New Orleans is getting hammered, but there are different parts of the country that are not. And so if you must have the therapy because your disease is getting worse, then you might want to think about if you need to drive to another place to get it done. I mean, I'm thinking outside the box here.
Yeah.
Again, definitely talk to the physician, definitely think about it. But if you're really in a tight position, you might need to explore some of those other options and think outside the box.
So we keep hearing, the general public keep hearing this term immunocompromised, and I know that's a term that NET patients are concerned with. Like, does that mean us? Essentially, is what they're asking. And so I have a specific question, but Laura asked, is it the cancer that makes us immunocompromised, or is it from the lanreotide therapy, or am I immunocompromised at all?
No, yeah. So Laura asked a good question. So in general, the cancer is not okay. Let me start with the second one. In general, the injection does not make you immunocompromised. So neither octreotide nor lanreotide have been demonstrated to be immunosuppressive. Okay. The medication that is definitely immunosuppressive is everolimus. Okay, so if you're on that medication, definitely is. The PRRT, as we just mentioned, can be a little immunosuppressive. If you're on a medication called temozolomide, you can be immunosuppressed for sure. If you were on chemo and your counts go down, you're definitely immunocompromised. So those are kind of generic things to consider. The way that the cancer makes you immunocompromised is actually not by the cancer itself, but the secondary effects of the cancer. So for example, if you have a lot of cancer and your liver is weak, okay, then you're immunocompromised. If your nutrition is poor because you can't eat well, then you're immunocompromised. If you're having other issues like a lot of hormones or heart problems, right? So if you're not delivering blood well and your body's weak, you're going to be immunocompromised. So those are all the kinds of things you need to discuss with your physician to say whether or not you're any more at risk. Again, remember the transmission still happens, by social contact. So you want to be more careful about those things. But those are the kinds of immunocompromised situations that generally apply to neuroendocrine patients.
Great. Thank you for clearing that up for us. We have time for two more questions, and I've got two great ones for you. Crystal asks, can you explain the difference between carcinoid syndrome symptoms and COVID-19 symptoms? Are there similarities?
Yeah, so that's a little bit complicated, Crystal. So, so in general, and again, I'm no COVID-19 expert. Okay, so let me just make that clear. But in general, what we found is that the COVID-19 starts. Again, it can be quite a disparate presentation. But in general, people kind of have like these flu-like symptoms that just don't get any better and don't improve with the normal maneuvers. So they can develop fever and they can develop kind of like this heaviness and a little bit of difficulty breathing. And those are the things to watch out for. And they can come in either order. It usually comes from a little bit of the lung itself. So these people have either worsening oxygenation, like just a heavy chest, and just feeling difficult. That's why so many people are being put on oxygen when they come in the hospital, because they just can't get enough oxygen for them. And really what happens is it's a very inflammatory disease, at least what I've been hearing. Mm-hmm. It's very inflammatory. It can cause problems to your kidneys, and cause problems to your heart, and cause lots of other problems. And the reason your lungs are just very sensitive, because if they get wet, they can't transfer oxygen, right? So it's inflamed. It's like if you have a swollen arm or from a bruise or something like that. If your lungs get swollen, they cannot exchange oxygen. So that's why people are feeling so heavy of breath. Unfortunately, that's kind of like very similar types of symptoms that people get when they have kind of lung neuroendocrine tumors. Okay. Generally from the gut and the pancreas, they tend to have digestive issues. So they tend to have, diarrhea. They tend to have kind of flushing symptoms. They may have abdominal pain. So those are a little bit different. But if they come from the lung, they can overlap a little bit. It can be a little bit different. So basically what you want to look for is anything changed.
Mm.
Since neuroendocrine tends to be a relatively slow indolent disease, most people have these persistent symptoms as have had it for a long time. But if you feel like something's changed, that's when you have to call your physician and find out if something is different.
Got it.
But fever is usually the thing that we watch out for.
Mm-hmm. Good point. So,
especially fever that is not sensitive to Tylenol and ibuprofen. If your fever is not going down, despite your kind of usual maneuvers, that's a problem.
Copy that. That's good info. Last question. Pam asked, can you comment on how you do telehealth or online doctor's appointments? Like how do they go down?
Yeah. So I'll tell you how we do it now, Pam. So my practice is a little bit unusual. And so a lot of people kind of come. So the telemedicine has actually been extremely helpful. So this is how we do it. If you're local, okay, I'm sorry, telemedicine. So for specific telemedicine, we actually do it through Zoom. I think we have a special account which is HIPAA compliant. And so what happens is you'll call, okay, so if you're a new patient, you'll call my office and you'll talk to my administrative assistant. Her name is Alejandra, and then she'll get you hooked up. We'll try our best to get all your records and all your scans, and this is where we need help. So if you could help us, send the information over. And then we use a system called nucleus.io. So if any of you are interested, just look on my Facebook page. But nucleus.io is a system where you can upload your scans and I can look at them with you. You can share them with me. So
that's cool.
And then it's just as if you were sitting here with me in this room, okay? Except it's like how Rain and I are right now. You get on your computer, you have my undivided attention for an hour, and we sit and we study your case together and we talk. So the one thing I can't do is I can't examine you, I can't stuff, but people will show me things. And to be frankly honest, I usually don't need to do a very thorough physical exam because I can look through your body because the scans have all been done usually. So most of the time I can figure things out. We may have to order some things. I may have to send some stuff over to your local physician to order labs or other scans, but I can tell you those things. But you have my undivided attention for an hour. If you're a return patient, then same thing. You get an appointment, you have an appointment on my schedule, and I will sit with you for however long you need, the 15 or 30 or whatever minutes. I will review your scans with you. We will talk about your symptoms. I will come up with a plan for you. It's essentially not that much different than if you're sitting right here. The only difference is you can't enjoy all my zebras in the room, and I can't physically touch you. But usually those kinds of things are not so important. The most important thing when it comes to this kind of a thing is developing the team, right? So understanding that we're a team in this, and two, developing a plan. And it's that time that I can study it with you. That's why I can't do internet medicine, right? So I had to study it with you. You have to tell me what's going on. Frequently, I don't get all the records, so sometimes you have to fill in the gaps for me. And then once I have all that information, then we as the patient, as the physician, as the caregiver can come up with a good team approach plan in which we can figure out what's best for you. So that's how we've been doing it now. So it's very much through this, and it's in really what it is. You have my undivided attention, so I can study your case.
Awesome. Thank you. Well, Dr. Liu, any final parting words for neuroendocrine tumor patients during this crazy time that we're in?
Yeah, it is a crazy time. What I would say is everyone should just be calm as possible. It's not easy. I know it's not easy. And unfortunately, the media definitely is, because media is so in our face all the time. It is, I don't want to say it's sensationalized because it's true. Some of the things you hear on the news are actually true, but they're not happening like next door to you. Sometimes they are. I mean, like I told you, I have a person that I know who's now intubated with COVID. So I worry and pray for him. But at the same time, just understand the risk for getting it is still relatively low. And there are people who can get the disease and still recover from it and be okay. We've had friends in New York who've gotten the disease. It was not fun. But they got through it and they've survived. So think about that. Be more diligent. Wear your mask in public so people can see that this is an important thing to do. Protect yourself, protect others. Exercise social distancing. I mean, Easter's coming, Passover is here. I mean, there's so many things that don't give in to the temptation. If you can just be at home, be with your family, be alone, you know, Zoom with them, whatever it is you need to do those things. But and wash your hands. I mean, that's actually probably the most important thing. Wash your hands multiple times. But remember, if you're sick and you're getting sick, you can still die of neuroendocrine. So if you need help, get the help. If you need help, do what you need to do to get the help. So understand that life still goes on even amongst all these things that are happening. So if you still need medical care, get your medical care. If you still need scans, get your scans. If you still need treatment, get your treatments. But always be in good communication with your primary care doctor, as well as your oncologist and your net specialist. And that's just be smart about it. And everyone should stay healthy, and we pray for everyone.
That's great advice. Well, thank you, Dr. Liu. Thank you for everyone who attended today. Our numbers have maintained really, really high for this this episode today of the series. So if we didn't get to your questions, again, I urge you to follow up with the Carcinoid Cancer Foundation. And we will be doing these on a weekly basis. So stay tuned here on the Facebook page for our announcement for next week. And that is due to the support of our presenting sponsor, Lexicon Pharmaceuticals. We are super grateful for them. We wouldn't be able to do this without them. Super grateful for Dr. Liu spending his time with us and doling out his wisdom from all his years of being a net expert. And we are super grateful to all of you for joining us today. If you know someone that would benefit from this, please share the link. It'll live right here on the Carcinoid Cancer Foundation Facebook page. And we hope you join us next time for our Facebook Live series. Bye, Dr. Liu. Bye, everybody.
Bye, everyone. Be safe. Be healthy.
Be safe.